Most causes of back pain are benign, which means non-serious. Think of muscle spasms, like a back spasm or a muscle sprain, and these injuries usually occur during heavy lifting, extreme exercise, and sometimes just doing chores. But in some cases, we are more concerned about serious causes of back pain. An x-ray will usually be done in the following situations. Let's say there's a patient who has a cancer risk. They don't really have very strong risk factors for having cancer, but we have a vague suspicion that they may. An x-ray will help us examine the spine. Another cause that can be readily seen on an x-ray are compression fractures. So remember, these are women who have a high risk of osteoporosis or already have osteoporosis. They're going about their day just doing the regular things, and they develop an acute fracture, and this can be seen on an x-ray. And then finally, we have ankylosing spondylitis. It's also known as axial spondyloarthritis. This is a disease of back pain that affects usually younger men between the ages of 20 and 40, and they wake up with morning stiffness. They may have alternating buttock pain. The morning stiffness will respond to exercise, so during the day their pain actually improves. Sometimes in the middle of the night, usually in the latter half of the night, they'll awaken because of the back pain. Ankylosing spondylitis can be seen and diagnosed on an x-ray. Now, more serious causes will actually require an MRI. So let's say there's a strong cancer risk. Think of patients who already have active cancer, they're getting treatment for cancer, and then they develop an acute onset of back pain. Then there are cauda equina syndrome, which is basically a compromise of the spinal cord that can lead to paralysis. So think of the individual that has been having worsening weakness in their legs. They're having difficulty with walking. They've developed changes with urination, with retention. They're not able to empty their bladder all the way, and they're having difficulty with fecal incontinence as well. In severe cases, they may also develop what we call a saddle anesthesia. And what that means is that they have numbness in their groin region. An MRI can evaluate this, and if this is present, it will need referral for emergent surgery. Then we also have the infection risk. So if you're an IV drug user, or if you have an indwelling dialysis catheter, those can increase your risk for developing bloodstream infections, and they can develop pockets of pus in the spinal canal, which can cause back pain, and MRI is used for that. And then finally, we have signs of radiculopathy. Radiculopathy is when you have neurologic symptoms such as changes in sensation or weakness in a region of the body or a part of a limb. And those can also be seen on an MRI. Now, once the cause is identified, the physician will direct treatment for whatever the diagnosis is. But most causes of back pain are not serious. In my next video, we're going to cover medications that are commonly prescribed for back pain. Until next time.